At the lab, the sample is tested for HPV. If HPV is found, then the lab then proceed to check for any abnormal cells. If abnormal cells are found, then you'll be referred for a colposcopy, and this involves using a speculum just like in cervical screening, but instead this time a microscope is used which stays outside the body and looks at the cervix closer up. Now, depending on what abnormalities are present, the colposcopy, some patients are then asked to have simply a follow-up checkup. Sometimes a biopsy is taken, but also treatments can be given at the time, such as removing the abnormal cells.
In my case, after I was found to have abnormal cells, I was offered a large loop excision, which uses a thin wire with an electrical current to remove abnormal and precancerous cervical cells. This is a common treatment. It sounds gruesome, but they do anaesthetize the cervix. I would say it was comparable to the discomfort of cervical screening.
So that is if abnormal cells are found on the cervical screening test. Meanwhile, if no abnormal cells are found, a follow-up cervical screening test is arranged for 12 months' time, and this is to see if the immune system can clear the virus itself, just like I mentioned earlier. If you happen to have the virus detected on 3 consecutive times during the cervical screening test, but without abnormal cells, then a referral to colposcopy is also done, as this is suggestive of a persistent HPV or a viral infection that the immune system is struggling to clear. If you do not have the HPV detected on the cervical screen, then that's a normal result, and you'll be simply re-invited for your cervical screening as normal, so that will be every 3 years between the ages of 25 and 50, and every 5 years between 50 and 65 years old.